So welcome back to my YouTube channel. My name is Dr. Racheal, and we're going to still continue to dive into the journey of fibroids. It's quite bumpy here. So yes, so how do we manage fibroids? As a clinician, I'm sure it's a different perspective, but I'll try to make it simple. So, women fibroids, women fibroids, kind of goes together. It gets worse still when you have specific risk factors, women fibroids, your black fibroids, you're in your reproductive age group fibroids. You want to get pregnant and you still have fibroids. You're pregnant, you have fibroids. So its management is everything encompassing you as an individual. I always say that being able to manage patients has to be from a tailor-made perspective. So you start with assessing the patient by taking history. When did it start? How long has it been for? What symptoms are more worrisome to you? Is it the bleeding? Is it the getting in your nicely hourglass dresses, you just feeling a bump, or you went for a routine ultrasound scan and you just don't like the fact that you have fibroids in there and you do not have any symptoms, or you have other symptoms like we mentioned in our earlier videos. You should watch them, really, by the way. All right, and then you go on to checking you up, like doing an examination from head to toe to see how it has affected you, in terms of checking for if you're pale, that means you have low blood levels, or even if it has affected your heart performance. Because you see, when you continue to bleed from fibroids and you do not replenish the blood loss, you would have what we call anemia, which is low blood levels. And this anemia could affect your daily activities by making you tired, dizzy, having fainting spells. And over time, when this has continued for a long period of time, it could also affect your heart's function. So you start having your heart overworking itself for trying to drive in blood into other parts of the body, and the blood is not sufficient enough. And then it could tip you into what we call an anemic heart failure. That means that your heart just stops. I don't want to work again, I'm tired. The heart could also get that way. So fibroids, even though they may just be there, they're benign. That means they do not cause cancer, only in 0.1% of cases, which is very rare, despite the fact that they do not cause cancer. In spite of that fact, they could affect your life and your life performance. So your health performance can continue to go down. And not to talk of the psychological effect of how, when you go for a party, you're out with your friends and you start to bleed so heavily that it stains your clothing, or you stand up from, I'm like, hello lady, you just, there's something dropping and it's blood. Honestly, it's devastating. And because of all of these things, as a doctor, as a health professional, it's important for us to know which of the symptoms of fibroids affect you more. Is it the frustration of getting pregnant and having recurrent and multiple miscarriages? Or the excessive pain you sometimes feel during your periods? Honestly, I can only imagine how it feels. And for this reason, assessing you is so important to knowing exactly how best to treat fibroids. So, I haven't taken the history from you to know what exactly the symptoms are. We need to check you from head to toe to see how these fibroids have affected you as an individual, your health performance. Now, having discovered exactly what is going on, during our assessment, then we need to carry out investigations. These are tests we need to do. Some are blood tests, some are like radiological tests like ultrasound scan, something we use, with a monitor, and we can put on your tummy to see exactly what is in your womb, the location of the fibroids, the size, the number, and how it has affected the womb in terms of its architecture and all. So all of these things we need to find out. And like I said, blood test. We need to also check the level of your blood. Is it low? Is it high? Is it okay? Other factors in your blood, has it affected other blood parameters and all? Now when we have all of this, then we can say this is the best treatment tailor-made for you. So in our next episode, we'll now talk about exactly what we need to do to get those fibroids out of there, or what not to do. Because guess what? Not all fibroids need something. You don't have to do something about it based on their size. So if you want to hear more from us, go ahead and subscribe to our YouTube channel, turn on your notification buttons, press like, and I'll see you again. Bye for now. Time with Dr. Racheal.